안녕하세요. 미사웰직과 임상철 원장입니다. 완샹하오. Hello, I'm Sang-Chul Lim at Misha Dental Well Clinic. It is great to connect with you again through our Dentium Live and follow-up session. Before we start today, I want to give a big applause for an incredible mammoth hands-on course recently held in Delhi, India. It made its way into the Guinness World Record as the largest dental seminar ever, with 1,136 dentists participating. Dentium never failed to impress. As always today, live surgery will be performed by Dr. Chung. The focus will be on contour augmentation in the lower anterior region, using osteogenocollagen and collagen graft too. We will also be using the advanced bright tissue level implant system. We'll get a clear look at simple implantation techniques and how to do bone grafting on anterior narrow ridge. Now, let's go over today's case before we move to the surgery room. Let's take a look at today's case. The title is, as I mentioned before, contour augmentation on lower anterior region using osteogenocollagen and collagen graft 2. About the patient information, his age was 67 years old, male patient. Chief complaint is that I want to extract another front tooth and replace implant brand new teeth on the lower, the same area. Past dental history was extraction of 34, 43, 44, 2 months ago. And past medical history, medication allergic to amoxicillin. This one is a panoramic view of our today's patient. As you can see, about the lower anterior area, the first molar to first molar, it is not good situation for restore with the natural dentition. So all these remaining tools, remaining teeth and the root remnant should be extracted and replaced with the implant supported prosthesis. About the CT view, cone beam CT view, about the 31 area, 32, 33, 43, 42, 41 area. As you know, this area is so narrow and looks like a knife edge style, remaining bone height and bone width. So it is need more approach about this optimize on this narrowed ridge. The intraoral view of our patient, only 2 natural teeth remained. Another teeth was extracted 2 months ago already. And we have to replace for the number 34 to 44, premolar to premolar, the 8 missing teeth area. So 6 months ago, as you know, from the panoramic view, as you know, the root last remnant here and the severe caries, severe decayed teeth was there, and all of these teeth should be extracted before the surgery. Today's the treatment plan is the implantation area will be 33, 41, 44 area using the bright tissue level, as I mentioned before, and also simultaneously contour augmentation and the alveolar ridge preservation using the brand new materials, osteogenocollagen and collagen graft too. And about this, the diagrams notifying, explain about the simpler GBR procedure combined with the bright tissue level. So the implant picture, the bright tissue level implant pictures installed on the host bone, own bone, and the labial portion, sometimes buccal portion, should be done by GBR procedure using the osteogenocollagen, and sometimes we can use collagen graft too instead of a collagen barrier membrane normally. So today we can see clear about these new biomaterials, osteogenocollagen and collagen graft 2 working, how these materials working on this depressed narrowed ridge area. About the bright tissue level, this one is actually the already improved, already proven to the stability and longevity and the safety, right? So very thin, deep, sharp thread is one of the key of this implant system. This sharp and deep thread gave higher insertion torque and initial stabilization, and also this one is easier insertion, like as a softer bone and the hard bone also. About osteogenocollagen, this one is very unique and versatile bone grafting materials. The particles osteogeno, genograft, and the holding by the collagen, the binder. So they mixed each other and the holding, the collagen binder holding, all of these particulated bone graft materials. So easy molding and easy handling and easy soaking and optimal collagen absorption speed achieved for this defected area. It is very important factor to make a new bone formation when you have a GBR procedure or bone contour augmentation. And about the collagen graft 2, this one is actually the collagen matrix, approved actually and improved collagen, the matrix. So this one is also applied on the soft tissue healing and soft tissue augmentation. For this purpose, this collagen graft 2 is very versatile. However, also we can use like a simplified GBR procedure or the contour augmentation procedure. Okay, we're gonna see this similar case 1 before starting the surgery, cause a more comprehensive understanding for the attendee. The anterior immediate implantation and socket preservation, focusing on lower anterior. As you know, the periodontally compromised area. So all of these lower anterior teeth should be extracted and replaced by implant supported prosthetics. About 42 area, the very thin layer, the labial bone, extremely thin. So after extraction and implantation, and the need something to do more, like a contour augmentation or the labial GBR procedure. Okay, the extraction on lower anterior for anterior teeth. So between the canine to canine, for all anterior teeth was extracted, and the drilling, osteotomy for implantation, and the installation of bright tissue level by simple osteotomy protocols. Normally, lower anterior area, diameter 3.0, the length maybe the 9 or 11 is optimal. Sometimes we can use a little bit narrow diameter, 2.5. Okay, after insertion, we can do the connect with the digital abutment. This abutment has some notch, so it is the the notch surface intact, actually the intraoral scan or some BTS, bite tray technique, the indicator, working as an indicator. So we can move to CAD program and the manipulation and management hold this digital procedure, and finally comes into the CAM machine for the final restoration with a custom abutment. Okay, so one implant installed, and actually another areas, the bone grafting procedures was done. And this one is post-op CT. The bright tissue level inserted this narrowed area on number 42. And a little bit bone grafting on the labial portion. Connect with the healing abutment and the scan abutment. Actually, this scan abutment working as a healing and working as a analog, a digital impression. Okay, and the temporarization, the connect with just only one installed already, the tissue level implant of bright, and another areas, the bonded by the resin bonded temporary restoration to the nature tears. Canine to canine. Okay, let's move to the today's surgery. So Dr. Chung make a crystal incision using number 12 blade. So normally, as you know, this crystal incision and the clavicular incision is essential part for the flap reflection.
그래서 크렌징 해가지고 이따 심을 때그 패스가이드를 쓸게요.
The normally lower jaw, the crestal incision should be located mid-crestal area, mid-crest. And upper jaw, normally a little bit inclined to the palatal, from the mid-crest, 2 millimeter, the palatally inclined, the incision line is optimal and normal for the crestal incision. Okay, try to the root tip forceps for extract the remaining piece. Now is using the elevator. The traumatic extraction is essential part before the starting the bone grafting procedure and the implantation procedure, right? So we have to get enough time for this extraction procedure. Okay, the extraction was achieved. The root tip forceps. saline irrigation. So today's target area, number 33, 41, 44 area. Why these target areas? The selected was selected for what? Depending on the host bone qualities and quantity, right? So as I mentioned before, on the panoramic view, number 33, 34 areas is good for implantation, the main position. However, 33 area is better than 34 because of the 33 areas are better bone quality and bone quantity. And also the opposite, the arch, number 44 is better for the relatively the neighbor area, the better than neighbor area. So 33, 44 is a main target implantation area. And also the number 41 area is another candidate for the good implant installation, right? So main target of today is the tree implant installation on the good bone quality and quantity area. Okay, before starting flap reflection, Dr. Chung is the cross-checking. Again, the crestal incision line for the clear cut and the flap reflection, the clean flap reflection. Sometimes he can use this periodontal curette explorer, as you can see just before, and the knife, number 12 scalpel, and number 15 scalpel, and the doors are part of scalpel. There are many, the various, the method to the cross-checking, the clean cut of this, the incision line. Okay, he just surveyed about this area, granulation tissues and some areas, depressions, and some defect size and defect depths. And he is navigating using this periodontal curette. I think he is manual navigating about this, the remaining bone morphology, like a bone mapping, the manual type. And changing the instrument, the small round curette. This instrument is one of most attractive of Dr. Chung. Dr. Chung is extremely prepared to use like this, using this small round straight mold curette. Everywhere his surgery videos, we can see this small round mold curette. Okay, so flap reflection and removing the granulation. Socket area. This socket was 2 months ago already done by Dr. Chung, the root rest extraction area. So 2 months is not enough to socket the filling with the new bone. So just to fill with the granulation tissues. Okay, some granulation tissues removed. detached from the socket wall. And a little bit more and more checking the reflection, the flap. Okay. Actually, additionally, I want to say about the crestal incision for the implant surgery or GBR or some another the procedures proceed after incision and flap reflection, as you know. So lower jaw, basically the mid-crestal, the crestal incision is normal, and the basic incision line. And about upper jaw, as I mentioned before, a little bit palatally inclined. The horizontal crest incision is better for flap reflection and flap management due to cause of the palatal, thick palatal flap, right? So 2 millimeter, the palatally from the mid-crestal area is better to manage flap during the surgery. Okay, so he is checking and the surveying and navigating all these, the edentulous area. And oh, yeah, he is using the round bar. And this round bar is also one of the preferred item of Dr. Chung. This round bar is most effective, very effective, removing the granulation tissues. Sometimes granulation tissues removal is very difficult, just only using by hand instrument, right? So sometimes we can use like this rotary instrument, round bar. And this round bar also used by smoothing, the removing bone spicules and irregularities. I loved this round bar also. So for me, I prefer to use round bar from the Sinus Simple Kit. Sinus Simple Kit had the matchstick style, the black head, the long shank round bar. And that was very effective and useful and very versatile. The main usage for the making the lateral window. However, sometimes we can use like this, removing the granulation tissues and removing irregularity, the bone spicules. They're very effective. If you get the chance, you have to use, you should use this, the black cat matchstick style long shank, long bar from the Dask Simple Kit. Dask Simple Kit is brand new kit. And after all these granulation tissues from the socket area and the edentulous area, and he is going to have pilot drilling with a Lindemann drill attached with the blue rubber spacer. This spacer have a different diameter, so we can imagine the dimension, the final restoration's dimension. So we can get the proper position, the insertion position when you have osteotomy, right? So can you see the 6? This 6 means diameter 6 millimeter. So this is this instrument, the parallel pin and the spacer, a blue rubber spacer, is promote the easier to get the proper position when you have osteotomy without any guide on the edentulous area, right? Okay, so the first, the high speed, the Fisher bar was used for the cortical. And after that, the normal speed with the Lindemann. Normal speed means 1,000 and 1,200. Why Dr. Chung used high-speed bar before using this Lindemann? The reason is very simple. Because of this, the cortical bone plate is easy to slippery when you have a lower speed Lindemann drill. So if you want to get the proper position, so before using the Lindemann drill, that you're gonna get the proper position using high-speed taper bar or small round bar. Also useful to get the proper positioning. The thick cortical plate area. And after that, changing the drill with Lindemann, 1,000 to 1,200 with a saline is normal speed and normal usage. This area, number 41, and already initial the osteotomy was done, number 33 and 44. And inserting the parallel pin, checking the parallel and the direction of osteotomy site. Okay, the perfect angulation and the direction was achieved by these devices, using these devices. Okay, so what is next step? Oh, yeah, the insertion of implant fixture. Okay, diameter 3.0, I think 9 millimeter. Little bit deep insertion for the marginal bone. According to the marginal bone, the remodeling. So he considering about this marginal bone remodeling. So a little bit deep insertion. Okay, all the treated surface, SLA treated surface was buried into the host bone, and the top portion of this, the polished color exposed the supracrestal area. As you know, this bright tissue level implant have a built-in connection, built-in screw abutment, built-in screw type connection. So basically this one is external connection style. Okay, the Lindemann. This final drills, Lindemann style, the Lindemann surgical kit, right? Even though the final drill, looks like a Lindemann drill. So more effective. I think 4 times faster than normal style, the final drill with the fruit, right? This one is more effective. Minimum 2 times higher, you can saving the osteotomy time. Okay, yellow band. We can see the yellow band. It means 3.5 diameter, as you know, right? All the implant system from the Dentium company have the same color coding, even though the different implant system. 3.5, and I think, okay, the green, the band, 4.0, right? Okay, so Dr. Chung is going to have a implant fixture on number 44 area, 4.0 diameter, and the same as 33 area. Oh, okay. He's stopped just before going the little bit the big size of final drill 4.0. So he stopped on number on diameter 3.5 on 33 area. He's not going to go 4.0 on number 33, right? So I think 3.5 on the canine area, 33, and 4.0 will be installed number 44.
그리고 콜라겐 그래프트 조그만 거 일단은 하나 넣어주시고요.
Okay, this one is the osteon geno collagen, right? The collagenized graft materials. This kind of graft materials prevailed nowadays. So the reason is here. The easy molding, the moldable and manipulation is manipulation. That is big benefit to use this kind of graft materials instead of the particulator. And this osteogenic collagen is more softer than the osteon 3 collagen. The cause of osteon 3 collagen composition of is alloplastic materials, osteon 3, little bit harder. However, this one is a xenograft from the bovine. So osteogenic collagen is a little bit the molded and a little bit sticky compared to osteon 3 collagen. So I think the bone, the forming potential will be higher than the osteon 3 collagen because this one is from the xenograft. The origin is xenograft. Okay. 1, 2, 3 small pieces of osteogenic collagen was inserted for the alveolar ridge preservation, and 4.0 diameter, 11 millimeter, right tissue level implant inserted on number 44 socket area. Hand ratchet engaged for the proper depth positioning. I think the initial stability was enough. Okay, another one, 3.5 diameter. I think the 11 millimeter also. The insertion speed is a little bit higher. Dr. Chung prefer to have a little bit higher insertion speed. The 50, right? The ordinary recommendation from the company to install more the speed, 25 RPM or 20 RPM. However, Dr. Chung is a little bit faster mode. I prefer to a little bit faster mode. 50 RPM. Okay. So hand ratchet engagement for a little bit more talking, hand talking. Get higher and higher initial stability. I guess that the over 50 insertion talk, that was over 50 minimum. 50 is very important, the score number. Over 50 means immediate implantation and immediate the temporization will be available. About the 35 Newton means the immediate implantation with the healing abutment, right? Okay. A very simple alveolar ridge preservation using osteogenocollagen, the brand new biomaterial from Dentium company. And the Dr. Chung is going to engage with the healing abutment. Actually, the official name is scan abutment, the comfort cap. Official name is comfort cap. This cap working as a scan abutment and also working as a healing abutment, have a dual function. So can you see the notch? The top portion of this scan abutment, the notch is very important to detection from the intraoral scanner. So for me, actually, I want to get the parallel notch, the same facing the notch direction. So for lower, actually this notch should be faced to labial. For me, actually, and upper jaw, this notch facing to the palatal direction. So all these notches are same, facing the same direction. It's better to detecting by intraoral scanner. However, Dr. Chung, the connect with the comfort cap, the notch facing a little bit different direction. It's good. Yeah, it's okay. It is also available. A little bit longer comfort cap was connected to the implant fixture. Now he is preparing the suturing for suturing. Before starting the suture, I think he is applied the collagen graft tool to the top portion of crest. It's not going to have flap reflection more or the peristal releasing incision. But he want to have a compact surgery. He like a compact surgery. So no displacement anymore, this labial gingiva. It means the preserve the keratinized zone with the original portion, not displacement anymore. However, the flap will be open. So for the compensate this gap between the buccal, the labial, and the lingual flap, he is going to applying this collagen graft tool on the gap between the labial and the lingual flap. This collagen graft tool is that the collagen matrix have a two different layer, the compact layer and the porous layer, a little bit the loose layer, dense layer and loose layer. So the dense and the compact layer that should be facing the upper, the top portion, outer portion, and the loose and the some porous layer, the facing to the downward is the optimal usage, the proper usage of this collagen graft tool. The collagen graft tool have a little bit different the layer, the dense and the porous, dense and the little bit loose. So the dense layer should be facing the outer part, outer layer, facing to outer part, right? So that is a proper usage of this graft material. Okay, and this area is already healed site, so the primary closure is easier and achieved by simple interrupted suture, right? So whole the rich contours are preserved and saved by using osteogenocollagen and this collagen graft tool. So basically, this collagen graft tool is another the versatile usage. For me, actually, I prefer to use this collagen graft on the socket area, right? The socket preservation procedure, I always like to use collagenated bone like osteogenocollagen and covered with this collagen graft tool, the top portion, right? Let's see, immediate implantation or immediate the socket preservation, socket preservation. Let's see, extraction and the removing whole the granulation tissues, whole this socket was exposed. So when I have a socket preservation technique, filled with osteogenocollagen or osteon 3 collagen into the socket first, and then the top portion covered with the collagen graft and the simple cross suture, the hidden X suture like this suture technique was applied, and that's it. And just leave it during 2-3 months later. After that, when you have implant surgery, we can see very nice, well done, well organized newborn formation into the socket, right? So even though the periodontal compromised case, the same. The loss of labial wall case or some the proximal wall lost case, same apply, same application. Extraction, removing whole granulation tissues, and the packing, the collagen bone, like osteogenocollagen, and the cover by this collagen graft, the collagen matrix, the product, and the faster, the promoting, the faster soft tissue healing, and I think this collagen graft actions working as promoting soft tissue healing, like this open wound style, open wound area. And also these graft materials, collagen graft 2, applied as a free gingival graft procedure. So you can use these graft materials with a palatal-free concept, the palate-free concept, right? When you have a pre-gingival surgery or the connective tissue graft surgery, you're going to use this collagen graft to instead of the original, the connective tissue from palate of your patient. So anyway, I think this collagen graft too is very versatile, the collagen matrix material. So I think I want to get a little bit more and more, the wider the indication for using this collagen graft too. For my daily clinical situation, the clinical practice, this collagen graft 2 is the recipe and sources for the surgery. The collagenated bone and this collagen graft 2 is essential part for my daily the procedure. Okay, the sutures was done, almost done. As you know, the interrupted suture first and the horizontal mattress suture or the cross sutures will be applied for the flap intimacy closure, right? For me, extraction socket site, I prefer to use the hidden X internal cross suture. Another name is hidden X, right? So this another rich areas, I prefer to use the interrupted suture plus the horizontal matrix suture. And the suture materials 4-0 basically, and sometimes I'm going to use 5-0 suture material. Okay, he is trying to have a horizontal matrix suture because of this, the cross suture, not horizontal matrix, just cross suture was performed, the closing this extraction socket area. Okay, I think about number 42, 43 area need more suture, not for a flap closure. This collagen graft exposed area need more suture. Okay. Insertion. Oh, yeah. The labial part horizontal matrix suture-like, and however, the crossing to the lingual flap with the cross direction. So finally, this suture is a cross suture. As you know, the cross suture have a two different way. First one, the external cross suture. Another one, the internal cross suture, right? So internal cross suture is another name, the hidden X suture, the same as internal cross suture. The internal cross sutures, the pressure, the underneath, graft materials, and like this collagen graft. Some materials can be pressed by suture nut when you have an internal cross suture. Okay. So you want to make another suture nut on this exposed area. Today, Dr. Zhang make a little bit the tight suture nut. To make a primary closure on the surgery site. Cause of underneath bone grafting material and the collagen graft material, the collagen matrix materials, right? Okay, so I think the surgeries was almost done. Okay, Dr. Zhang was achieved very successful and wonderful lower anterior area surgery today. Thanks again. Okay, we will have a 10 minutes break, and after that, we will have a Q&A session. Okay, thank you for watching, and stay tuned. Welcome back, our live surgery show. Let's see to this, the follow-up of today's surgery. As you know, this just after the surgery, post-op photo, after suturing, and the intraoral view looks like here. Even though the higher the comfort cap was connected, so this comfort cap, especially number 41 areas, is soft tissues clipping to the healing cap, but for the intimate suturing technique. But anyway, the suture and the final situation of this surgery was good, looks good, very nice. And this one is a panoramic view after surgery. So as you can see, number 44 area, the 4.011 millimeter, the tissue level implant was installed, and the number 41 area, 3.09 millimeter, and number 33, the canine area, 3.511 millimeter implant fixture was installed, connected with the healing cap, the comfort cap, the healing, and the scan body, the dual function, the devices. And as you know, as you can see, some the temporary looks like a little bit the shadows comes out on this panoramic view. What about the post-op CT, cone beam CT? About 33 and 41 and 44. I think direction was very nice, the same direction and the good position, perfect position, even though the manual type insertion. How can he achieve like this result? First of all, actually he got the lots of experience about implant surgery, like this anterior, lower anterior region. And number two, can you see the surgery video? Before the starting flap deflection and the installation, Dr. Chung using the many different kind of devices was applied for mapping remaining the bone shape and defect area and hold this situation detecting with a manual hand instrument. So he organized the perfect positioning and the perfect angulation before starting the osteotomy. And after that, the starting with osteotomy, the perfect, the ideal angulation and the depth was achieved. And the 1 to 3 implant connect with a comfort cap inserted here. And this one is 1 week after surgery. Can you see the very impressive situation is here. The collagen graft 2 was applied, as you know, this between number 44 and 41 area. However, this exposed area, the covered with the collagen graft 2, just only 1 week after, we can see soft tissue healing so fast, right? So a very friendly biomaterial that is the clear, the approval, the evidence of this collagen graft 2 is higher friendly soft tissues biomaterial, right? So just only 1 week after, almost the epithelial cells, epithelialization of the epithelial cell was closed, this top portion of exposed area. So incredible and the impressive situation. Okay, the intraoral scan after 1 week of the surgery and make temporary the restoration 8 unit, right? From the first molar to first molar, opposite dentition, the supported on 3 implant fixtures, supported 8 unit temporization, temporary prosthesis was inserted into the implant surgery area. So this one is intraoral view. For, as I mentioned before, the 8 unit temporary prosthesis supported by 3 implant fixture. Just 2 weeks ago, inserted implant fixture support hold this 8 unit PMMA temporary prosthesis. I think useful and effective and the very cost-effective treatment protocol like this on the narrow reach of lower anterior, right? Okay. 2 months later, for the final restoration, intraoral scanning or bite-to-tray procedures also applied for this situation. Bite-to-tray procedure or intraoral scanning, both are available for the final restorations procedure. And after that, the final restoration will be applied on this lower anterior narrow ridge area. Can you see the ridge width? 2 months later, we can see the ridge width maintained, right? Underneath this ridge, osteogenocollagen and collagen graft 2 was working for maintaining this ridge width. Okay, thank you for this, the question. One question was here, why do you use collagen graft 2 instead of membrane material? Basically, collagen graft 2 is collagen matrix, right? So a little bit different the usage and material, the membrane and collagen graft 2. The membrane is optimized for the protecting underneath bone grafting area, right? Even though the semi-permeable, anyway, this membrane working as a barrier, protecting underneath the bone grafting materials until when these graft materials are changing to the newly forming bone, right? So the first, the mission of this membrane, the barrier function, from what? Actually outside of the cells, fibroblasts and epithelial cells want to invade into this empty surface between the bone graft material. So this membrane's main, the function, the barrier and the protecting for underneath bone grafting materials, transforming newly forming bone. That is main issues. And about the collagen graft 2 is a little bit different. This collagen graft 2 is collagen matrix working as promoting the soft tissue healing, right? So these graft materials apply this, the empty spaces, these materials promoting soft tissue healing, right? So faster epithelialization and fibroblasts moving to these areas and these, they intermingled each others to the soft tissues and collagen graft 2 is transforming the host soft tissues. So main, the aim is promoting soft tissues. The faster, make soft tissue healing faster, right? Sometimes this collagen graft 2 is working as a barrier function like a GBR procedure, and however, it is a limited addition, limited some, this function will be limited. Why? This collagen matrix is not too dense, so and so faster absorption compared to membrane. So it is not enough time to maintain underneath bone graft materials until this bone graft materials transforming newly forming bone, right? So between these two different biomaterials, first, a different function and different aiming. First one is protecting for underneath bone graft materials for transforming new bone formation. Another one is matching to soft tissue and make a soft tissue healing faster, right? Also, the little bit auxiliary function will be the protecting underneath bone graft material, right? So if you want to have 100% newly forming bone making that is aimed, you have to use this barrier membrane. And however, the contour augmentation concept, volume up concept, some part of grafting materials going to newly forming bone, and another main part transforming to just intermingle with the soft tissues areas. That means we can call volume up concept. So you applied this collagen graft too instead of membrane, right? And another one, the aspect, another issue is here, membrane, the blocking the blood supply. So very thin overlying flap, or so the flap design and flap thickness of the biotype, thin biotype of overlying flap will be removed and the necrosis by using this membrane. Why? This membrane, the blocking the blood supply action, right? So the thin area, thin biotype, and the lack of soft tissue area, you have to caution. You have to get some the gentle usage and have some caution of use this collagen membrane as a barrier membrane. However, this collagen graft 2 is soft tissue friendly and absorbing, high potential of absorbing blood and some the molecules. And so I think even though the thin biotype, thin layer, and a little bit shortage and lackness of primary closure case, collagen graft 2 is much better than use membrane, right? This one is promoting and accelerating blood supply and the soft tissue healing. This one is actually basically blocking the blood supply actions will be happen, right? Two different way. So finally, I can recommend you want to have, if you want to have original concept of GBR procedure, you have to use membrane, collagen membrane as a barrier function. However, sometimes hybrid type and a little bit the modified style bone grafting and GBR procedure and the bone augmentation, including the volume up and contour augmentation concept, you're going to use this collagen graft to give you a high beneficial effect compared to the, just a simple collagen membrane, right? That is my answer. Okay. Oh, thank you. Thank you for watching today. Actually, this real Korean time is 8:15, 8:20. Okay, night 8:20. Thank you for watching again. And next live surgery will be held May 17th, the same time, Korean time, 7 o'clock. Operator will be Dr. Jung-hyun Park, and moderator, Professor Youngdan Cho. Okay, so 谢谢大家, thank you. Xin cảm ơn. Bye.